Hello everyone, good morning. As I promised you earlier, I'm going to talk about the external features of the heart. So stay till the end of the video and also make sure you hit a like and also subscribe to my channel, that is Anatomy for All. Thank you. This is the heart. This is a hollow muscular organ present in the middle mediastinum. So here you have the heart with the covering, and this one is without the covering here. And here you can see the fibrous pericardium, and inside will be the serous pericardium, which has two layers, that is inner visceral and the outer parietal. So serous is divided again into inner and outer layers. Now coming to the other identifying factors, let's see. This one is called the apex. This is the apex of the heart. At the back you have the base of the heart, which lies on your palm. So that is base of the heart. This one is called the apex of the heart, and apex is directed downwards, forwards and to the left side, and it contributes to the left ventricle, and it is present roughly at 5th intercostal space. And base is present posteriorly. This is the base, and you can say that it contributes to the left atrium, and also it contributes to small part of the right atrium. So here is the right side and this side is the left side. Next, here you can see that there are surfaces. There is anterior surface, which is also called the sternocostal surface, and it is related to sternum and costal cartilages. So obviously that is why it is called sternocostal surface, and it is formed by the right ventricle. This side is right, and right atrium, and also mainly by the left ventricle. The left atrium is at the back, so that does not contribute. So these three chambers contribute to the anterior surface. In the upper part, you can see two ear-like projections. They are called auricles. There is a right one. This is the right one, little bluish in color, and there is one more here hanging, and that is the left one. So this is left auricle, and that side is right auricle. You should see which side this is directed, the arch of aorta. So this is left, this one is right. So inferiorly you can see diaphragmatic surface, which is very close to the pulmonary trunk. So this is pulmonary trunk. You just come down here and there is a triangular area, and that is called the diaphragmatic surface. It faces the palm actually. When you hold it in your anatomical position on the palm, with the index finger supporting it, you can see that the diaphragmatic surface lies over the palm. So it is present next to the pulmonary trunk, so easy to make out. So this is the diaphragmatic surface, this is the anterior surface, at the back is the base, that is posterior. So now here there are other structures, like you have the ascending aorta. So this is the ascending aorta that you can see, that is coming from the left ventricle, and that continues down as descending aorta. And you can see two things, that is superior and inferior vena cava. So there is a superior vena caval opening and inferior vena caval opening. This is the superior vena cava and this is inferior vena cava. So let me put a small probe here. So passing the probe through the superior vena cava, and it comes out through the inferior vena cava. So this is the superior and the inferior vena cava. Okay, it is formed by right and left brachiocephalic vein. And then you have the inferior vena cava is coming from below. The superior vena cava is formed by right and left brachiocephalic vein. And what joins the superior vena cava is the azygous vein, which drains into the superior vena cava. That you should remember. And coming to the posterior aspect, you can see there are openings here. There is 1, 2, that is superior, and there are 2 here, that is inferior. So there are 4 in number. What are they? They are pulmonary veins. They are coming from the lung, bringing the oxygenated blood. And where do they open into? They open into the left atrium. So this entire thing on the back side is left atrium. So all these are openings of the, all these are openings. There are 4 in number. They are all openings of the pulmonary vein. So here you can make out very easily superior vena cava, inferior vena cava. This is the right atrium. This is right ventricle, and this is pulmonary trunk, and this is arch of aorta, and it divides into three. There is brachiocephalic trunk, there is common carotid, left common carotid, and left subclavian. Okay, this again divides into right common carotid and right subclavian. You can divide it here, and I think it is little higher, so you don't see the division here. Alright, so now whatever you see here, this is called the auricle. This is right auricle, and this side will be the left auricle. This pulmonary trunk is coming from the right ventricle. Arch of aorta is coming from the left ventricle. So atriums are above, they are receiving chambers, and ventricles are below. So this is about the heart, that is external features of the heart. And by now you know I'm Dr. Rohini. I'm from SCMCH RI Channapatna. Thank you so much.